We're covering a heart model today. We're going to focus on blood flow through the actual heart. And we'll talk about how it goes from the right side to the left side and the lungs in between. We'll also look at how do we supply the good blood to the heart itself. When I say good, oxygenated blood, so the heart can beat 3 billion times over your lifetime. We'll also look at just some of the basic structures, but let's talk about the blood flow first. Remember, we have two types of circulation typically going through the body. The systemic circulation, to where we're providing all that good blood to the body, bring it back to the heart, go give it to the lungs to provide it more oxygen, bring it back to the left side, and then back out the systemic circulation. So you have the pulmonary circuit and the systemic circuit. So as I pull this off, I took off the front half, so I had a frontal cut or coronal cut. And let's look at first the two chambers on top are my two atria. Remember, it's how it sits in your body. So if I put it here, I'm looking at this is my right side, this is my left side. So I have my right atrium and my left atrium. And then I have my right ventricle and my left ventricle. My left ventricle is my largest with that thickest muscle layer, the myocardium, because it's got to feed all that good blood down to my feet. So as we go through systemic circulation, I'm going to bring all the blood that I've used. It'll go from either the top of the heart or the bottom of the heart. And I feed from the top by way of these two blue vessels called brachiocephalic veins. Brachiocephalic, brachio referring to the arms, cephalic referring to the head. So as I fed from everything from the top of the body, I bring it back by way of brachiocephalic veins to feed into the superior vena cava that goes into the right atrium. From the right atrium, I go into the right ventricle. How do I do that? Through a valve. That flap here, the white flap running across, is the right atrioventricular valve because it's going from the atria to the ventricles. It's also called the tricuspid valve. So I go right atrium, right ventricle. Once I get in the right ventricle, I want to prevent backflow back into the right atrium, so I have to close the valve. We have these little cords, tendinous cords here, called chordae tendineae. These strings that are attached to the valve, chordae tendineae, are stimulated at the base of these, and I can see them a little bit better on the left side. These muscles are called papillary muscles. We contract those papillary muscles to pull on the chordae tendineae to close the valve to prevent backflow. So from the right ventricle, our goal is to get to the lungs, the pulmonary circuit. I go through this pulmonary trunk, which leads me to the pulmonary arteries to go to the left side and then the right side. This is our first example to where our arteries are actually more bluish in color. So most of your models will show them as either purple or blue, but everywhere else our arteries are red. And we always use arteries to take blood away from the heart. So structurally, the terminology, arteries take blood away from the heart, but in this case, they're blue because we've used up all that blood. So when I bring it through the pulmonary trunk, I go through this valve called the pulmonary valve or pulmonary semilunar valve, and I'm using pressure to go through here. And I go through my pulmonary trunk to my pulmonary arteries, and that's going to go to the left side, versus now I have pulmonary arteries to go to the right side. And when I say right and left, I'm going to my lungs to obtain that oxygen, bring it back, as I turn this around, through my pulmonary veins. Pulmonary veins are now the opposite of color again, because veins bring blood back to the heart. But veins are now red in this case because they're oxygenated. So I bring that blood back into the left side. So if you can see those four vessels, now when I look inside, I can see that there's four holes there. Those are those four vessels that dump into the left atrium. From the left atrium, I go into the left ventricle. How do I do that? Another valve. So I go through the left atrioventricular valve, also called the bicuspid or mitral valve, and that gets me into the left ventricle. Again, I have the strings, chordae tendineae, stimulated by papillary muscles to pull on the valve to close it to prevent backflow. Once I have it in the left ventricle, I want to get it to all my systemic circulation. So now I'm going to pump it through this valve, that white valve there, which is my aortic valve, also called aortic semilunar valve. And then it's going to go through the aorta. And as I go up, it's going to arc, and that arc of aorta is then going to drop down and descend, and it'll become thoracic aorta and my abdominal aorta and start to feed all that good blood to the body as I go down. As I come up, I have these three major vessels coming off the aorta. The first one is the brachiocephalic trunk, the brachiocephalic artery trunk. And then I have these two, my left common carotid artery and then my left subclavian artery. So it's asymmetrical when it comes to my brachiocephalic vessels. I have one brachiocephalic artery, one, and that's the trunk. I have two brachiocephalic veins, if you remember when we started the video. So I have brachiocephalic trunk that's going to then branch into a right common carotid artery and then a right subclavian versus my common carotid and subclavian, left common carotid and left subclavian arteries are coming directly off the aorta. So that's how I create that circulation to feed all that good blood from the left side to the body. As I understand blood flow for the heart itself, and this can be confusing for students, but basically as I look at this, I'm using my aorta as that mechanism. Remember, the aorta is going to come out, our largest vessel, to feed all of the body. But there's a point here where it'll open up, and some models do it better than others, but you can see just this little hole here, and then on this side there's a hole here. And basically what it's saying is I'm going to have the start of my coronary arteries that are going to feed that good blood to the heart. So when I put this back where those holes were, I'm going to put the front half back. Those holes is the start of my coronary vessels. So on the right side, the red one, this is my coronary artery, the right coronary artery. On the left, my left coronary artery. So these are the primary vessels coming out of the aorta that's going to feed good blood to the heart. Because just like any other organ, I have to provide that oxygenated blood along with everything that's transported in the blood to provide that nutrition. As I come down, I got to feed the right side. So as I'm going down the right side, I have that right coronary artery and it'll branch here. And then I have a cardiac vein as well. So the blue cardiac vein. Then I have ventricular branches and then I have marginal branches. So I have my right coronary artery, my ventricular branch, the red, the right marginal artery, the red. And then you can see my blue vessels that are retrieving the blood that was used, and it's actually going to dump right back into the right atrium with those cardiac veins. So I have that mechanism to put it right back into the system we talked about before of getting it into the right atrium. On the left side, left coronary artery will branch down to what's called the anterior interventricular artery. So anterior interventricular artery is that red one. In between the ventricles, I have an anterior artery. So anterior interventricular artery. The blue one is the great cardiac vein, the great cardiac vein. So as I come over and I turn to my left side, I'm also going to use this artery here. It's called a circumflex artery to continue to supply good blood. So circumflex, that great cardiac vein continues. I have more ventricular branches here because I'm on the left ventricle. But as I move over, what I'm going to start to see on the posterior side, first is this red vessel here that's now called the posterior interventricular artery. On the anterior side, the anterior, the red one, anterior interventricular artery, that major supply in between the ventricles. On the posterior side, as I come down, posterior interventricular artery, the red one. The blue one is called the middle cardiac vein. So remember, on the anterior side, we had great cardiac vein. On the posterior side, middle cardiac vein. And then what wraps around is a small cardiac vein. So what happens is I'm going to use all that good blood with my arteries. I'm going to bring it back to the posterior side with a great cardiac vein, a middle cardiac vein, and a small cardiac vein. All of that is going to feed into this coronary sinus. So those vessels are all combining, converging to one large vessel called the coronary sinus. That coronary sinus, if I turn this, it's here, it's here. If I open this up, then I have a spot where this is coming in on the right side. So that's going to feed into the right atrium. So all that blood that I used is coming into the right side. Other structures that we can learn on the atria, I have these little ear flaps called auricles. They engorge and help with pressure to move blood. So these are called auricles. When I look at the layers of the heart, what directly covers the heart is called the visceral pericardium. But now we can call it the epicardium. So what covers the heart as a membrane is epicardium. When I open it up, my muscle layer is called the myocardium. And then inside, endocardium. So 3 layers. Endocardium, and it tends to be shiny. Remember, we talked about these structures, but these structures are covered with a layer, endocardium. Endocardium inside, myocardium, the muscle, and then it covers the heart, epicardium or visceral pericardium. This is the heart.